Good afternoon, everybody. Thank you for joining us. My name's Kjersten Evans. I'm so excited to be here today and to discuss this new PBS documentary that's been done. It's called Fast Forward. We do hope that you've had the chance to watch the film before today, but if not, there will be a link that will be sent after this session and to your email, and it will be active for a few more days, so you can go ahead and watch it then. As the moderator today, I would like to remind everyone to kindly keep yourself muted. At the end of the program, we will open up for a floor discussion, so please write down questions and thoughts, and we can address them before we depart. But also, if you want to use the chat feature at the bottom of your screen, you are welcome to type questions throughout the discussion, and we'll try to keep up with those or address those in the end of our discussion today. So I do a little introduction about myself. I am a very recent graduate from the DNP Adult Gerontology Primary Program at Columbia. And I'm also the current palliative care nurse practitioner fellow here at Columbia as well. So I'm kind of doing two jobs right now. I'm working full-time in the outpatient oncology office, and then also working with a lot of patients that are needing extra support with chronic diseases or severe illnesses. So a little bit about myself. Ever since 2005, I've worked in the nursing field. I started out as a nurse practitioner, or a CNA, sorry, then worked as an LPN for a few years, and then an RN, and now as a new NP. I find myself often, I've worked a lot with the older aging population and older adults. And I feel that this film has really kind of brought forward some of the things that I've often struggled with, and definitely don't discuss enough with my patients and families. So I've worked with them over the last year. Actually, I've had a lot of opportunities to kind of discuss these with other patients and not my own family. And a big eye-opener when I watched this film this past weekend was realized that I haven't sat down with my own parents and had these discussions, and they're in their mid-60s. I felt very much attached to these four families that we followed through the film, and being in my mid-30s, they're in their mid-60s, and I haven't had these discussions. So I do think that this is such an important film, especially now as we're entering into this boomer phase of the world, and we're going to have so many people that are aging population to have these conversations and to get families more involved. For me, it was really interesting to watch the families as they kind of struggled through their week, to see what different aspects kind of triggered them wanting to have them realizing, I guess, what was their part in their function between their parent and the child, on what made them want to start planning forward in their life. So I am hoping in the next near future to kind of Zoom with my parents and have them watch this and start these discussions with them, as I come from a large family, so there's going to be 9 different varying opinions on what should be done. So I want to know what my parents have to say. So I think this is very important. So I'm very grateful for the vision with Michael Eric Hurtig, and also those who accept the invitation to be a part of this project. I think it gives everybody a chance to kind of look forward and start imagining, what hopefully 30, 40, 50 years down the road, these decisions can be finally put into place, but kind of what they want to envision for their future and to plan for. So thank you. And so now I want to kind of introduce our speakers that you see here on your screen. First, I want to introduce Michael Eric Hurtig. He is the producer and the director of Fast Forward. So I'll give the time for him to introduce himself.
Thanks very much. And that was great to hear your story and reaction to the film. And I'm looking forward to hearing the questions and reactions from everyone here today. Michael Eric Hurtig, producer and director of Fast Forward, and I have spent the past 4 or 5 years working on this project. I've worked in a variety of different capacities in the film business for the past 15, 20 years, and this was our first foray into this kind of programming that was seeking to educate the public and engage people on a topic that most of the public didn't want to engage with, as far as the research that we did told us prior to making this film and embarking on this. And I think likely everybody here with us today knows that it can be difficult to engage the harder to reach patients or harder to reach audiences with your messages around their healthcare, whether it be on a direct, practitioner to patient scenario, or working with a family. And it was quite a journey for us to pull all this together. But what was central to it, and I look forward to hearing everybody's thoughts on this today, but taking an approach that was a little bit more dramatic and a little bit more of reality TV approach to get people to approach it also with a little bit more of a sense of levity. Most of the works that I had seen out there before we made this project were very well done and beautiful and powerful, but there's such a weight to thinking about the future for most people, and there's a lot of fear there. So we tried to do something on the lighter side. I hope those of you who've had a chance to watch the film enjoyed it, and excited to further chat with you all today. Thanks for having us.
Awesome, wonderful. Thank you for that introduction. And yes, very much so this is needed. So I'm excited to kind of hear what other people have to say today about it. Next, I would like to introduce Dr. Brenda Janotha. The floor is yours.
Hi, I'm Brenda Janotha. I'm a nurse practitioner and an educator. I serve as the director of the adult gerontology primary care nurse practitioner here at Columbia Nursing. I would like to thank Michael for this film because it really does bring to the forefront a lot of the issues that we have. And it does bring to the forefront the conversations that we need to have. I've been providing primary care to patients and families for 22 years. In my practice, I care for patients across the lifespan, so from adolescence into adulthood, and in some cases, end of life. I also care for patients across the continuum of healthcare. So I see patients for routine and acute care in my outpatient clinic, as well as where the patient is. So sometimes I see patients in assisted living facilities and in their homes when they're homebound or unable to travel to their appointments. Many aspects of the Fast Forward film resonated with me. The social isolation and the impact this has on overall wellness really is astonishing. This is something that needs to be planned for in advance. Many people underestimate the effects of this isolation. And I think where we age is so important. I know that was a big theme. The isolation that elderly patients can face sometimes affects their self-care, their mental and physical health. And I really like the idea of that Philadelphia cafe, which was a great place for encouraging the generations to socialize with each other. I think that both the younger and older generations really can gain a lot from each other. Additionally, that storyline that followed the daughter and the mother planning for the Airstream backyard camper was very eye-opening. And I think a lot of people should really think about, where we're going to age, what places we're going to age in, the physical space. Another important theme that I just wanted to mention that I really appreciated with the Fast Forward film was empathy. And as an educator, I really believe that empathy is an essential quality for all healthcare providers to possess. And it's not something we can teach necessarily. I really like that the MIT Agnes suit that simulated that 20 to 30 year aging, physical aging, was developed to really help younger people to gain that empathy of the physical restraints that the elderly often face. I think I wanted also just to point out that I really feel that with this COVID pandemic and utilizing more technologies, that it's going to give us a better way also to care for our vulnerable geriatric patients. We're able to, access them better through telehealth, through calls, phone calls, and I think that's going to help to open the door too, to have a lot of these conversations with their families, you know, to really incorporate families. So I just wanted to point that out too. And thank you again for this opportunity.
Yes, very much so. All of those points. No, I agree. I thought that cafe was awesome. I was like, I'd like to go there and hang out with some people and chat. So we'll make one here in New York for us. And now last but not least, I want to introduce Dr. Gregory Alexander. He is also a faculty member here at the Columbia School of Nursing.
Hi, thanks for having me. Yes, I'm a faculty, I'm a professor in the Columbia School of Nursing. I'm the School of Nursing Alumni Association professor. And I've been a researcher for over 20 years, and I've been a nurse since 1988, so for a very long time. And my whole program of research has been trying to improve the quality of life and quality of care for older adults. And I've worked in particular and worked in areas both in nursing homes, assisted living, and home health. I've done a lot of work in acute care. I've also worked in occupational health and in community health. So I've really been around all those settings, which I think gives me a very broad perspective. And in particular, what I'm interested in and have always been interested in is really technology's impact on clinical processes and workforce, and how technology can improve resident outcomes. And in the last couple of years since COVID and the ramp up toward COVID, have been very interested in how technology can be used to reduce social isolation and things. And so as I thought about this film and I listened to Michael talk, I had not thought of this being a reality TV show until he said that. And I thought to myself, I'm hoping that I don't know that I could watch a reality TV show like this, because it would be too hard, I think, to watch. I think it just conjures up, maybe it's my age, because I think I'm the older one here. I also have 5 children. My oldest is in his mid-30s. I have a mother that's 75, and my father passed away about 6-7 years ago from colon cancer. So this sort of hit home with me, because I've had those crucial conversations both in my research and in my personal life, and they're just not easy. And even though we try to make them easy, I don't know that they ever will be. My key takeaways really from the film were in the key remarks that people made, and I just give some of those to you. Some of them that stood out to me. Somebody said to me that being old, or said to me as I was watching the film, being old is a state of mind. And I think in some cases it is. I have a 90-year-old aunt who is extremely active, who I drove to Texas about a month ago to see her granddaughter graduate. And she is that person. She does not think she's old at 90, and she's very active and drives and is out and about, and very different than some other people, that I know that are not as old as her, who have very sort of limited sort of scope in their life, much more limited than her. Another person questioned, can older people have a meaningful, engaging life? And I thought that was sort of an introspective comment, because we all have a different idea about what that might look like based on our own experience and how we interpret that in other people's lives. And then one woman also said, who was in the suit, who was getting ready to live in the camper, which kind of frightened me a little bit, because I have a camper, and I thought, if my kids tried to make me live in a camper, in my pop-up camper, which I have done, I don't know that I would be happy about that. She said her world was small and she felt claustrophobic, and she was afraid, and she felt isolated, and she didn't want to be out of sight and out of mind. I think all of those words and those phrases, as you watch this, are important to write down and think about, because many people have these ideas in their minds as they get older, and it's important to reflect on what people think about their lives. And so for me, that's what stuck out. Thank you.
Yeah, thank you for that perspective, because I think I was trying to imagine how do I convince my parents to watch this with me? I don't know if I tell them it's a reality show about aging, if they'll do that, or if it's, I don't know what we'll do, but we'll figure it out. So thank you for that. So now I want to go into asking a couple of questions. We can, I'll present the question. You can just unmute yourself and respond as you want and kind of start a dialogue. The first question that I thought was important to kind of discuss and kind of go over is, and see your guys' perspective on this. So one of the goals of the film was to encourage families to plan for aging, and while they are younger and healthy rather than waiting, right? So I guess what would be some of your thoughts or perspective or ideas on what role can medical professionals have in planning this and helping out?
Well, I can start. And, Kjersten, I heard you say that you were a geriatrician, you're practicing that. And I remember back in my undergraduate years and even in my first part of my graduate years, I really didn't get a sense of what the needs of older people were as much as I felt like I should have, especially because the numbers of people that are getting older these days. We just need to be prepared to care for them. And I think we need to have a very good perspective of the physiological changes, because this film brought out many different physiological changes that quite honestly were all too real to me. And then psychologically, sort of the aging, the effect of aging on your psyche is kind of intense, especially as you get older and you see your kids getting older, and socially, what it means for you socially. And then I also thought it was really important for us to be prepared to and to be able to respect the burden caregivers have for caring for older adults. We need to create, as clinicians, open pathways to discuss those burdens, both away from the older adult that is being cared for, but also simultaneously while they're there in the conversation, so that everyone is aware and can participate in the goals. And so I thought those two things were very important in preparing the medical professionals.
Absolutely. And to piggyback on that too, it's having that conversation. I think that is so important. It's a very difficult conversation to have, but I think as primary care providers, we can also, over the years, we develop those rapports with our patients and their families. And even just being forthcoming and honest that, these are the issues that we want to not even prevent, but preserve, so that, the patient's wishes are met, as well as their physical needs. So, I really think that's a really important part of our role as medical providers, is to really have the conversation, open it up. And a film like this is a great opportunity for that. We can send the patient home with information, and, maybe just watching it with a family member can help them to start to have that conversation.
Now, although I'm not a practitioner, a medical practitioner, as a filmmaker and as an observer through this process, what was quite fascinating was, the through line throughout the film, family dynamics, and how are these families going to do this together. It's not aging is not a solo act. Aging together, we can age more successfully, is what I think everyone learned that participated in these boot camps we put them through. However, seeing the children with their parents and going to a hospital setting, or going to the neurologist, as they did in Oregon, Abe and Leo, we see something that isn't that common at this age. A child isn't usually going to be accompanying their parent to any medical appointments. They're going on their own, and the incorporation of having an understanding of family beyond the patient, I think was really interesting to see at this. I know as people are older, there's more of an inclination to have other family members there who are possibly the primary or secondary caregivers. But that was interesting to see at a younger age here in this setting. And it makes me think also of a commentary that's not in the film by Dr. Perez from UPenn, who sees really diverse groups. And she said, she had lots of patients who, can I bring 3 people to the appointment with me? And that's just was a world away from anything that I've ever seen or experienced or sort of thought of in my own life. So here's the patient's perspective here to contribute to this conversation. But anyhow.
No, I thank you for those perspectives. But I do think as I've started to be more of a practitioner on the side of things rather than being the nurse, it's kind of been a very big learning curve actually, how to open up this conversation. And something I've learned through working in the palliative care team is we're opening this uncomfortable can all the time. We're always bringing up the conversations of, let us go down this path and kind of just discuss what would be your wishes if you were to preserve them somehow. And a way that we often will phrase it as providers, the palliative care team here is we'll say, a lot of people obviously will say this is like a tough conversation to have, but a very large gift that you can give to your children and to your family is to start this conversation, or at least write it down, so that if we come to a time where we need to make decisions or help you make decisions, we can reflect on this and have it available for future, when you need it. So kind of getting it there. And then how you said how families attend meetings or visits, I've often tried to have my parents call me while they're at their doctor's visits, and the doctor always thinks it's the strangest thing, but I really like it because then I can actually help them when they're calling me about their medications and asking me if they can get rid of some of them. I'm like, let's discuss. So I do think it's something that we should start incorporating more of a family unit when we're doing healthcare, because and I think this film, like Dr. Janotha said, I think, if we can send this home as a tool and have patients kind of reflect on it and start thinking about it with their families, even though it's uncomfortable and nobody wants to really watch this in that sense, but it's I thought it was comfortable to watch. My husband, who doesn't like thinking about aging, he also thought it was very interesting. So for that, yeah.
Kjersten, if I could just say, you mentioned tools, and I noticed in the film, the suit was a tool. They also had the 5 wishes sort of tool to use to begin the conversation. There are many different kinds of tools to help people even start the conversation. And I think just being aware of what those tools are, in a recent demonstration project that we had funded by the Centers for Medicare and Medicaid, we were trying to prevent hospitalizations from occurring in nursing homes. And so we were working with families and working with older adults in nursing homes to try to have crucial conversations when they had a change in condition. So, what do you want to happen? What kind of care do you want? Where do you want to go to receive that care? Do you want to go to the hospital? Because sometimes the staff makes that decision as opposed to the person that's actually experiencing the change in condition. So giving people tools can really give them a stronger voice in their care, because they have a guide. These people aren't really trained to do this kind of stuff or to talk like this in normal life. As clinicians we are, but other people aren't, and so it's very foreign to them. So having those tools are super important, and I think that's one thing the film brings out, is that to be able to experience what it's like to be older in a suit that limits every possible feature that you have is telling. I mean, it helps you understand a little bit more about what it could be like. So I just sort of throw that out there. Get familiar with tools. I think they're important.
Yeah, I think in healthcare we love tools and skills and those kinds of things, but the 5 wishes is a great way to start. That's one we often use here to kind of start discussing things. So thank you. So the next question that I kind of highlighted to kind of continue this actual same vein of stuff. When discussing and what have you found, I guess, to be successful or not, I guess, in participating in discussions when there is denial about health conditions that will only accelerate with aging. So how to kind of get past that, I guess, or any pointers on that?
So I think, as we've mentioned before, denial is a big issue, and we saw that with the father and son in the film. You know, the father was definitely not willing to have that conversation at that time. So I think, again, having the rapport, involving the family early, before we need to start to make these decisions, being really forthcoming about the process of aging, I think that would help a lot. I think too, planning, a theme in the movie as well was to plan for the symptoms and the stress of illness, so that might be a nicer way of, bringing the conversation to the forefront too. We're planning ahead because this would be a stressful situation, and how can we, manage this a little bit more effectively.
I'd like to comment that in the film, we see Dre and Roger, and his dad, Roger, isn't interested. He's not ready. He doesn't think he's ever going to be ready to fill out these documents. After filming, what wasn't on camera was he came just as we were leaving his house, and he said, "Hey, can I get a copy of that document, of that 5 wishes document?" And I thought, great. 2 years later, we followed up with them this year, and we have little videos on our site that show where everybody is now. But unfortunately, that didn't last, and those documents still haven't been done. And one thing that I think Dre did well, and is an interesting tool, is for the children in these scenarios, or whoever the caregiver or the support person that would like to, break through this denial and get some of this ironed out and figured out, talked about, can use, is doing it themselves. And Dre has, in the past 2 years, he did all of this for himself. He did all of his, took care of his legal paperwork and advanced directives and everything. And although his father still is denying, doing these forms, he is at least then able to have start the conversations and even ask some of those questions. And his father at least has to answer some of those questions because they're right there. It's easy. It's just one question. And I think I've seen in all of my conversations, we partnered with the Conversation Project there in the film, and there's so many different strategies, but one is starting with some of those easier questions and not starting with a conversation about the person's, chronic healthcare issues, but instead, where might you want to live? I want to live. I don't want to live in an Airstream, that's for sure. Where would you want? So I've seen many different strategies, but it can be so tough because everybody's so different. But Roger, I think Roger serves as a great example in the film of the harder to reach audience and people who are going to be more difficult in terms of getting those, but I think the conversations can still take place.
Yeah, I wrote, as I was sort of taking notes, I wrote listen, listen, listen. And I wrote that because I think we need to understand where people think they are in their own process of aging. And if you listen to, the father and the son, they really conflicted quite a bit about their perceptions of how he was aging. I mean, the son, the one that you were just talking about, Michael, what said, I don't see his health inclining in the next 20 years. I mean, to me, that was super telling. He was actually seeing him declining. And the father had a completely different view of his worldview of his health. And I can relate to that. You know, I'm not on any meds, and my wife's not on any meds. Yeah, we're 60 and healthy and walking miles a day. You know, I mean, it doesn't feel like we're older. And so I don't know if we're prepared to need to be, but I think people need to understand, at least when they're talking to me about my health, where I'm coming from in my own experience as I get older. I also thought the important thing here in this film too, that was sort of understated, was the interdisciplinary team that surrounded these people. You put into place many people that had many different resources. You had a person, a nurse, a physician, a social worker, a music therapist, artist, psychologist, exercise physiologist, engineers. I mean, you had people who could come at this problem of aging and better quality of life as you get older with very different perspectives and very different resources for addressing those problems. And I think as clinicians, we need to be very aware of what other disciplines can do to improve aging that are very different than what our scope is. And in my research, that's what I think that in some ways why I've been successful, is because I've heard other people, engineers in particular, who have really good concepts around helping understand gait and mobility and looking for subtle changes that maybe a person doesn't realize has happening until it's too late, and then they fall. So, you know, there's some really interesting theoretical and methodological approaches to this problem that are not just the type of clinician that you think addresses these.
Yeah, no, I think that's true. I was thinking, right as you were saying that, I was like, yeah, you need a team of people that are going to kind of help come at it from different angles and kind of support all these different needs as we kind of go about this. But yeah, I do think, I don't remember Dre's dad's name, Roger maybe. He reminds me a lot of, I think, how my father will be. And I think I often am just like, well, I know I'm going to have to just like chip away, like, all right, so, you know, at what point would you want to move to a house that's 1 floor instead of 2? Because right now, you know, so those kinds of things, like thinking forward, would you ever want to move? Do you want to stay here? Would you want to come closer? So those things are important to kind of, when you have the stubborn, I find like men are mostly, but sometimes women, but mostly when you have those that don't want to change too much, you can, you know, slowly get to know your parents and understand what they might, you know, might want or not want. So yeah, thank you for those ideas. So that's great. Another question that I thought would be kind of important, mostly because if I were closer to my parents, I'd want to be there, but would you, like, again, as practitioners, or even Michael, would you recommend, or would you ever suggest to an aging patient that they include adult children in their physical exam? I know in school we're kind of taught, like, let them be alone so you can, like, give them their privacy and dignity, but, you know, I'm kind of new to this, so I guess, like, why or why not would you recommend that?
Can I just ask a question? Greg, I don't know if you remember me, Pat Button. It's nice to see you. And you're still younger than I am, but anyway.
I do remember you. Thank you.
No, it's great to see you.
I saw your name. I was not sure if that was the same Pat Button that I wondered.
It's me, yes. So I am older than Greg. And I have to say that I don't think my children are particularly interested in this topic. I mean, I have all the documentation and so on and so forth. I have a living will. I've thought a lot about what I want and what I don't want. But what hit me about the film is that all these kids, I mean, they weren't really kids, but seemed to be there with their parents. And it seemed very, in many ways, unique to me.
Yeah, thanks for that, Pat. I'll comment on that because I've had 2 very different experiences with my parents. My mother is super independent. she's 78 and she still works almost full time as in a hospital as an EKG tech, and also in a nursing home doing hair because she's a beautician. And so she just sees herself as this vibrant, energetic, working woman, and at 79 and 78. And I mean, it is a little bit hard for us, her children, the three of us, we're like, when are you gonna like sort of relax? You know, and she just doesn't want to. And we've come to terms with that, and we've talked to her about that, because we think in some ways that's keeping her more healthy, you know, because she's able to continue to go and move. My father, on the other hand, just prior to his passing several years ago, had bowel cancer, never really went to the doctor. And in fact, because I was a nurse, I was his primary person. He would come to me with stuff. And, but he was very not forthcoming about what everything in his life. He didn't tell me until he was diagnosed with cancer that was untreatable and had hospice. And then all of a sudden he opened up with all of this information. And I was like, I mean, I still to this day think, had he been able to open up prior to that, or if I had been able to get him to open up, we might have been able to do something earlier. And you know, it's just knowing where people are in their stage of, in their aging process, to allow them to open. And sometimes they're just not going to, but sometimes they'll tell you everything, you know, so just depends on the person, I think.
But I think, excuse me, I'm sorry, Brenda, I'm interrupting you, but I'm actually more interested. I mean, I'm 76 and vibrant in my opinion, although I've had a knee replacement and my osteoarthritis bothers me a bit more than it used to. But I'm more interested in your thinking, your experiences, or others' experiences in an older adult engaging with their children.
So I feel like that's what I was just going to actually share, that I know how Michael mentioned the son filled out his living will before the father. And I think that's why it's never too early to have these types of conversations with our patients, even if it's just for them to set things up for themselves at a young age, or if it's even to open their mind to thinking about, oh, what about my parents? If I'm thinking about this for me, you know, as my parents are advancing in age too, is this something we need to think about with them? So I think that as primary care providers, we talk about this all the time at every annual physical with patients in their 30s, you know, in their 40s, in their 50s, you know, because I think that that also is eye-opening. And again, a film like this might be a nice bridge, you know, if your children watch something like this, maybe it'll make them start to think about, you know, the future as well.
And how would one, I'm sorry, Michael, how would one get access to this documentary to share with other people? If we could just get that information, it would be very helpful.
I could be incorrect on this, but I'll let maybe Michael knows. I think you will get a link after this is done. I don't know when it's going to go live, or Michael, do you know?
Well, I know that the film will be viewable at the link that you have for the next few days. I'm not sure whether it's the next few days or usually the next week after this screening. It is on PBS Passport, so anybody who's a PBS member can access it on any of the PBS video app or PBS website. It's also regularly broadcasting, rebroadcasting. It first broadcast in March nationally on PBS, and it's airing regularly on stations around the country. So they can also look for it on their DVR. It might be coming up. And in addition, they can get in touch with us at fastforwardmovie.com. We're continuing to do a screenings campaign through the end of the year around the country. No screening is too small. So if someone would like to bring together their entire family or their local community organization, we can set the whole thing up for them and do either digital screening, or we can also do something in person now. And it will be available streaming, but I don't yet have that information. Hopefully later by the end of the year. But it is streamable on PBS systems if you're a PBS member.
Oh, Pat, you're muted.
Did you say Botsford? Is
I'm
the
sorry?
name of your, what is the name of your organization?
Oh, is it
Yeah.
Fast Forward?
Oh, fastforwardmovie.com.
Okay, thank you.
Thank you, Patricia. Those are very good questions. Thank you for those. Those are great. And again, if anyone else has questions, we'll open up in a little bit, and on the chat, you can always type them, or we'll open up in a few anyway. But
I just want to add on, as far as the site goes, early on, Greg, you were talking about the suit and the different tools in the film that are used. And as a viewer, it's great to see those. A lot of people would like to try the aging suit. While we can't send people aging suits, we did try to create fast forward experiences for viewers, and for anybody that you'd like to share them with on our site. You can create your own personalized high school playlist, or for a loved one to try some music, without being a music therapist yourself, do it with a loved one, do it for yourself. There's also guides on having these conversations, living wills, and some other fun fast forward experiences there. And there's also video on the site, so if someone can't access the film easily, they're not a PBS member, they can at least sample some of the content. Thanks.
wow, that's great. I was actually going to, was one of my questions is, I was hoping after the film there would be like a continuation where you can have your family, you can sign up to do this with your parents kind of thing, but that works too. So that's great. I wasn't sure where we left off on questions, but I actually had one more question for you, Michael, before I forget it. I actually wanted to know, when you were trying to get people to participate, like these families, how did you convince them, or was there like a wide net cast kind of thing, or?
Well, there was a wide net cast. We worked with people all over the country and went through a variety of networks and slowly whittled it down to a select few. But the funny conversations to hear are, I think all of the kids that are in the film were excited to be a part of something interesting in a documentary. But when they first asked their parents, their parents were the ones who needed a little bit of convincing, and a lot of them didn't quite believe them at first, that this was even an experience that they might have. And I think that an interesting part of this is we did use a little bit of a reality TV format because nobody knew what to expect. And so although we were very ethical about how we did everything, unlike some reality TV shows, they really didn't know, the day they would be getting makeup. They didn't know we would be aging them, or they weren't aware of the aging suit at all. And so I think it was easier for them to say yes because they didn't have to, sign off on doing all of these really crazy experiences before going into it, which added, I think, to the great drama in the piece. So.
You just reminded me of something that I thought was really sort of an interesting, I don't know if you'd call it a dilemma, but the woman that was a model, and then her career was basically, at the point that she was involved with this, was in promoting anti-aging makeup and cream. And I thought to myself, my goodness, I bet she would be an interesting person to talk to, because she was sort of in a dichotomy. She was, you could tell she was very interested in appearing youthful, and it was part of her work and part of her job, and even her daughter was youthful. I mean, it was very evident. And I felt for her, because I felt it was really hard for her. It was hard for all of them, but I felt really for her because of her perception of youth and what it meant to her. Yeah,
Yeah, Carol actually told us that we hadn't aged her into her 80s, but we surely aged her to the age 115 because she wouldn't age in that way. You know, she comes from a family, and she would tell you this herself, that has really been, her mother had her sleep on a silk pillow when she was a child so that her hair would be more beautiful and kept better. And so beauty and maintaining beauty has been a really big part of their lives. And it's true. We went. What's not in the film? We went to her mother's birthday party, and her mother didn't look, as you know, everybody ages differently, but there's been a great focus in her family on that. So I think it was, and probably still is for Carol, quite jarring, and I feel she has the most distance from really imagining herself in a place where she might not have everything that she has now in terms of her possibly physical strength or her mobility. Yeah, she's a definitely a unique character in the film in that sense.
Yeah, and putting her in a conversation with that older woman who was 90 with the bright orange hair, because she was really beautiful in her own way. When you really looked at her, she was just a character, you could tell. Matched their personalities in some ways. I don't know if he did that on purpose, but it sort of drew out part of, and I think maybe that's important, you know, not every person that you're going to sit down and talk with has the same way of communicating. Think about how to communicate in different ways with different people. And if you're not the right person, find somebody who is.
Yeah, we really strove to find people that would have something they could have something in common with. And actually we found Tina, who is a woman who's 90 years old, working as the hostess at Cafe Frida in Philadelphia, we were actually looking for perhaps someone who had a passion for fashion. And we were going to take Carol to a store, fashion shop that Tina shopped at. And we only knew that because she was recommended to us. The person there said, you know, who would be really great for her to meet is this woman, Tina. She's the hostess of this cafe. So it was really match made, and it's great.
Wow, that's really cool. I love how, yeah, a lot of the show really did kind of spark some of those things that kind of make you look forward. I think some of them to look forward to aging, and me as well. I know it's something I often try to picture as I get in my 30s, and I'm mid 30s now, but as I feel more old by the day, I try to picture, you know, what will it be like in 10, 20, 30 years. And yeah, like I had said, I think Drew, when you put on the suit and you realize that pretty simple, in a sense, workout class, how stressing it became on his body, and the realization of that was quite shocking, I think, to him. So let's see, I think, let me circle back. There's the one question I wanted to just kind of talk about, and then we'll open up. If other people have questions or anything you want to ask, you're welcome to after this one, about just including the adult children on the physical exam is a good idea or not a good idea. Do you think it would kind of promote these conversations a little easier if the children were able to be a part of that? I know during COVID, I mean, I work in outpatient oncology where we often have somebody come in as a support person to most of the visits. So they're able to ask questions and kind of get a sense of what's going on. So it's not rare for us to have somebody else in the room. But in primary care and a annual visit, is that important, do you think? I think Dr. Janotha, you see a lot of people that probably could use a support.
Yeah, absolutely. I feel that it can go both ways. And I think, again, I know I keep mentioning having that rapport with the patient and their family is so important because, sometimes I feel like that father-son dynamic, I know we keep going back to it, but, he was a little more defensive because the son was kind of saying that, you know, maybe he is declining a little bit in certain areas. So individualizing it, I think, is the most important thing. You know, maybe, you know, involving family for certain aspects, how you mentioned, Kjersten, about, you know, maybe when we're prescribing or discussing, you know, treatment options, or, you know, things that maybe the patient might need some reinforcement with, including the family, and maybe not necessarily with the entire physical exam. But sometimes it's eye-opening for the patient too, because you know, the child who's in the room, the adult child who's in the room, can point out some things that maybe the patient doesn't realize, you know, certain areas that maybe they're declining in a little bit. So I think it's an individualized option, but can definitely be beneficial in a lot of cases.
No, thank you. And I think that's kind of where my mindset is, but I just was kind of curious on that as well. So I think that kind of concludes a lot of the questions I had. Did either of you guys, does anyone else have anything they want to, any other questions they have, or anything that they want to like discuss? Otherwise, I'm going to also ask our participants to chime in. You guys are good. Anyone, any of our participants? We have quite a few people there. I know we had a couple of the chats that came up. Some of the points Veronica had kind of made about, you know, the caregivers and how different options. I know I think my mom would have loved the idea of living in a trailer because she loves camping, but then seeing kind of how the lady felt so isolated and so kind of like unsteady on her feet and unsafe was pretty shocking to see. So I actually would like my mom to see that, because I'm sure she would love to try that in life, but not in reality, so in her dreams. But yeah. Any other questions? You can go ahead and unmute yourself or chat. If not, then we're getting kind of close to the hour. I don't hear anybody. Somebody chatted, hold on one second. Teresa says it is important to remember that older adults are pretty much the same persons they were when they were younger, with the same coping skills they've always had. Yes, I actually, Mike, when you were talking about Drew's Roger, I think, who still 2 years later hadn't filled out his form. And I thought about, you know, my father and how he would be too. And I'm like, yeah, zebras don't change their stripes. So we're going to kind of have those same behaviors most likely, even to the end. You know, people always kind of, even in healthcare, we see it a lot where people will continue to be the same person regardless of what obstacle they come up to. So it's important to kind of remember, regardless of if we're 20 or 50 or 90, we're that person all through our lives. So that rarely changes. So thank you for that point, Teresa.
Yeah, and I know we keep talking about conversations and having them, but also talking about aging with dignity. You know, I mean, we're all hopefully aging. And I think that it brings a dignity to it. And I think, again, that was, you know, the film really has some beautiful themes in it. And that's definitely something as a takeaway. And I think we can add that to when we have this conversation with the patients. You know, this is about, you know, aging with that dignity.
Yeah, no, agreed. I was actually, yes, a lot of the film, I was like on the verge of tears watching some of it. I mean, I probably did cry a couple times, and my husband kept saying, "Why are you crying?" And I was like, "Because it's so real. It's so beautiful." So very well done. Yeah, it's.
I agree.
Very real.
I'm wondering from the group here or anybody on the panel, of everything that you see in Fast Forward, which is the most difficult part of all of these projections into the future, you know, that we took everybody through 360 degrees, which is that which is most difficult to sort of break through to your patients with, to really get them to understand, and which would be the most useful experience, I think, if you could give anyone a single experience of going into their future so that they could break through something that they're inhibited to do, you know, focus on their aging.
I think the burden, you know, I think that I felt like every one of the people that you, you know, had in the documentary were more fearful of becoming a burden to their families. And I think that, you know, again, that goes with the planning, you know, that I think it's so important that we discuss, you know, what the future can look like early on, so that, you know, that feeling of being a burden is alleviated because we're planning ahead for it. I mean, I think that was something that
I sort of thought there was a something important about remembering that they were youthful at one point in their lives, and then in some ways they were still youthful when the lady started singing and clapping and dancing and doing the flamingo. It was a bit of a surprise when she said, you know, I used to be a flamingo dancer, because just looking at her, you would not know that. And you know, what it brought out for me was that, you know, to be aware that people have really important aspects of their life that can really make them youthful again and feel youthful. And we need to be tapping into those things as much as possible, because it improves their quality of life at the end of their life. And, you know, you have to be very intentional about that, I think.
Yeah, and actually that pair, or I should say trio, Abe, Leo, and Abe's mother-in-law, Carmen, they're regularly using music therapy with her now, and revisiting all kinds of music, which was just really beautiful and powerful for us to learn. And we were speaking with them, and she came and visited with us, and she's experiencing, you know, she has her diagnosis of Alzheimer's, and they're all living through it together. But the music therapy is really powerful tool for them. So I want to say to the group that anybody should feel free to reach out to us at fastforwardmovie.com, whether it's you'd like to share the film with someone, or have any further questions, or because you're considering using it as a tool elsewhere, because we're ready to help.
Yeah, no, thank you for those recommendations. There was a thought that popped up here from Claudia. She also said dealing with cost of care will be a serious problem. So I think, you know, like just trying to make a plan and trying to figure out which frame of care will work for each family is really important too, is starting to think of that, because as we know, healthcare is not cheap, and neither is these living places, so living homes, anything like that. So thank you. And there was another plug from Claudia for PBS, which I would also say I also subscribe to PBS. And so I think it's a great, you know, platform where they have a lot of different things. She had one that she watched last night that she said it was on mental illness that she recommends people also look into and watch. So thank you. Any other thoughts? I think Sharon just posted the link up in the chat as well. Otherwise, thank you all for joining us and for the participation. It was great. And again, thank you, Michael, for this film and for this opportunity to help us start this conversation with our loved ones. So thank you very much.
Thanks a lot, and thanks for having me, and for everyone for being here today.
Okay.